This video we're looking at what to expect after a simple knee scope surgery, but first, our disclaimer. Dr. Mike Matthews, physical therapist here with the PT 411. Thanks so much for joining me. If you already haven't done so, make sure you follow, like, subscribe, Facebook, YouTube, Instagram, TikTok, and Twitter. Also, make sure you check out thept411.com. So another WTE video, what to expect after a simple knee scope surgery. I say simple because many surgeries for the knee are performed arthroscopically, or what people say scoped. All this means is a small incision was made or several were made and a camera was inserted so that the entire knee wasn't opened up to expose it and look at what was needed for the surgery. This cuts down on recovery big time. So when I say simple, I mean nothing was repaired. No ACL, MCL, LCL, no repairs, microfracture procedures, no meniscus repairs. Now you may be thinking, well, I had a meniscus tear, so it was repaired. So this video does not pertain to me. Well, most of the time the meniscus tears are actually not repaired. They're debrided. It's just cleaned up. It isn't repaired. If it was repaired, you'd be under instructions to not put weight through the leg for several weeks. I can't tell you how many people I've seen that have had a meniscus debridement, but were under the impression that they had a repair. So that's what this video is about. People that had osteoarthritis, tearing, or buildup of scar tissue and so on that needed surgical intervention, basically just to clean up the inside, to debride it. Now this is a day surgery, meaning you'll be headed home as soon as you wake up and you are deemed stable medically. There are a few minor precautions early on, but we don't get too active. We rest, ice, elevate, take our medicines. Within a few days, you'll be starting PT. We have two early concerns: walking and motion. We need to make sure you can get around as well as possible with as little help as possible. People are very surprised of how quickly surgeons and PTs want you to walk without using crutches or a cane after this surgery. We also need to get back motion as quickly as we can. We have a window of scar tissue formation after surgery. The first 6 weeks, give or take a little bit, scar tissue is forming. The more motion we get back during this window, the better. It's much easier to tell the scar tissue how we want it to lie down than to stretch through it. Don't worry when we don't have all of our motion back by then, but be prepared for stretching to get more aggressive after that time. It's a big predictor of how well and how quickly recovery will happen with how much mobility we had going into surgery. So unless you have been told directly by your surgeon to not do so, it'd probably be in your best interest to work on bending and straightening the knee as much as you can tolerate before the surgery. You're going to have surgery anyways, so you might as well tolerate a little bit extra leading up to it to increase your outcomes. As motion comes back, walking normalizes, we start working more on strengthening. We progress this as quickly as the body allows us to. We mind the current status and symptoms as we do so. I've seen people after 6 to 8 weeks fully back to high-level athletics and running. I've also seen people that have taken 3 to 4 months just to be able to kneel down and get back up from the floor. It really does vary from person to person, how well they're doing leading up to the surgery and overall individual goals as well. Just know you are in complete control. Make sure you listen to your surgeon and your PT and work hard. Just know there is some pain in the recovery process, but in the grand scheme of things, it's a short window of your life. Again, I'm Dr. Mike Matthews, physical therapist here with the PT 411. Thanks for joining me.